Hi everyone, thanks for listening in. My name's Nat and this is my Physical Activity Intervention Program for EHR331 Assessment Item 3. Before I start, I'd just like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and culture, and pay respects to their elders past, present and emerging. So for the study, my participant is a 39-year-old non-Indigenous Australian female. She has a body mass or weight of 134.1 kilos at the start of the 2-week assessment, which gives her a BMI of 53, putting her in the obese category. She has no chronic conditions or injuries, and prior to starting the physical activity intervention program, I have asked her to consult with a GP, which she has done, and she's been cleared to exercise. Her blood pressure is normal, she's not pre-diabetic, and she has no other abnormalities in a blood screen, but she is at an increased risk of cardiovascular disease, type 2 diabetes, some cancers, as well as back pain and lower limb and joint pain that's associated with being obese, particularly in the long term, which can also lead to decreased mobility and limited balance. So we want to get her weight down, not because we care about what she looks like or anything like that, but because we would like her to reduce her risk of all of these chronic conditions. As a result of the initial 2-week assessment, we've seen that the participant is actually meeting the 150 minutes per week of moderate physical activity, as per the Australian guidelines. She's doing that through walking, both outside and on a treadmill, and also she goes to the pool a few times a week with a good friend and they walk laps in the pool together. Her friend is doing this for a rehab of a back injury, and she's doing it for a bit of movement and the social aspect, and she's really enjoying that. Her vigorous exercise is minimal and she's not doing any strength training at the moment. And she's also not doing any stretching or balance, so no yoga classes, no stretching after her exercise and such. She does have a sedentary office job and she travels to and from work about 40 minutes each way in a car, so she's got a lot of time sitting. We're just going to recommend, on top of the intervention program, the 12-week program, we're just going to recommend that she spends some time throughout the day just getting up from her desk, maybe filling a drink bottle, going to the toilet, maybe going and picking up files from the photocopier or whatever it may be, just to get some extra movement in there. Looking at how ready this participant is to change her physical activity and sedentary behaviour, the fact that she's already joined a gym where she goes to the pool, and she's actually signed up for a weekly boot camp to start next week, it tells me that she's been in the preparation stage and she's now moving to the action stage. She's set herself a goal of losing 24 kilos to get down to 110 kilos, as she wants to go skydiving again, which I really like this goal because she's not focused on how she looks. She is thinking about her health as well, but she really wants to go skydiving, and 110 kilos is the weight limit. So I guess the challenge here, once she hits that 110 goal, is making sure that once she's done her skydive, she doesn't just stop everything and go back up. So that's where we need to keep her enjoying exercise. So the social aspect is really important. And also in the initial 12 weeks at least, we'll have weekly meetings together to have a chat about not only the exercises that she's going to do for that week on her program, but also to chat about how she's feeling, how she's going with it all, any hurdles she's having, and to just try and keep that communication open to prevent relapse. The other thing in the program is that I've programmed her some extra rest. So she's got at least one rest day a week, and she's also got an optional second rest day. And there are days when the most exercise she'll do is go for a walk or go to the pool. So she's not going to burn out we hope. She's also got a history of mental health issues, depression, and she doesn't sleep very well. So the other intention behind this intervention is that she will keep her mental health healthy and also improve her sleeping habits. So we've set some SMART goals, a couple of goals. So for me, it's more about helping her to reach the guidelines. For her, it's about getting to that 110 kilos. So both of those goals are specific. The guidelines clearly state how much exercise the participant needs to do, how much of that needs to be muscle strengthening as well. And her goal is to lose weight to get to 110 kilos. To keep that safe, we're keeping it at average of 1 kilo per week. Both of those, again, are measurable, so the M in SMART. We can track the activity on the Fitbit that the participant has and also measure her body mass on the scales every week. It is adjustable because, sickness happens, life happens, so we're going to be flexible with her program. And 1 kilo a week is an average target. So some weeks she might lose more, some weeks she might lose less, especially as her body gets used to exercise. But that's our average target. And with the guidelines, she doesn't have to hit 300 minutes of exercise a week. It can be 150 some weeks, anywhere between that. And it's realistic. It's got to be realistic for this participant. She's been overweight all her life. So I'm not going to try and get her down to 75 kilos to help her hit the healthy weight range in the space of 12 weeks. That's not realistic. So we've set a realistic goal and we've time framed it. So the time frame for this particular goal, 1 kilo a week in 12 weeks, so 12 kilos. So obviously I'm not going to go through the whole 12-week program in this 5 minutes. I've probably already gone over time. But basically how we're going to do it is start with low intensity bodyweight strength exercises and stretching twice a week, in addition to her current physical activity. So her walking, her pool sessions, great cardio, great low impact, especially for her joints because she does have extra weight to carry. So we don't need to start hitting heavy weights straight away, and I don't want it to get too sore and be turned off it altogether. So low intensity body weight, low reps to start with, and we'll pick that up each week by adding reps every week or every 2 weeks. Add a couple of reps, add a couple of new exercises, start to add resistance through resistance bands and some light weights. We'll eventually get into kettlebells, and then I would anticipate after the 12 weeks she'll start a new program which will include more heavy weights and gym equipment if that suits her and how she's going. So we're going to include the pool walking sessions, as we said before, to maintain the social aspect and keep her motivated, and also include the street walking sessions that she's been doing in the past, just to get her outside and maintain a bit of familiarity, but also the change of scenery from inside the gym and the pool. And as I said before, we've got that mandatory rest day. So yeah, hopefully a little bit of weight loss along with some healthy eating, which she's been referred to a dietitian as well, will get her sleeping better, feeling better and healthier, and overall reducing those risks, and of course jumping out of a plane. Thank you for listening.